just going to head right in there, okay?
What we use breast MRI for is for women, particularly women who are just recently diagnosed with breast cancer and women who are high-risk women. The breast MRI has no radiation, so that's one advantage to MRI, but it's a very highly detailed study of the breast. It's more sensitive than mammography. However, there's things that MRI can't see and a mammogram can. That's why the mammogram is still the gold standard. A lot of women under age 50 and women who are on hormones who have what are called white dense breasts, it's very difficult to see things through on a mammogram because things overlap. So what MRI does is in these women who have very dense breasts and are at high risk, or women with breast cancer, it subtracts out that normal dense breast tissue and it allows us to see things more easily. MRI is not a screening tool for the general population. There are several criteria for high-risk MRI patients, and those include patients who are gene-positive patients such as BRCA1 and BRCA2 mutation patients, or the first-degree relatives of patients who have BRCA1 or BRCA2 mutations, women who have had radiation to the chest between ages 10 and 30, also women who utilizing criteria, little models that we use, who are greater than 20 to 25% at risk for developing breast cancer, and that includes models that are based on family history and personal history of breast cancer. And then there are other genetic disorders that make women and men high risk, such as Cowden syndrome and other syndromes. What contrast entails is a small IV in the arm, and they get a small injection during the MRI. And that's what we do for most women who have breast cancer, is when they go into the magnet, they'll have a little IV in their arm, and they get an injection, a small amount of liquid that goes into the arm that the nurse injects, and they will lie on the scanner with their arms down. It's on a cushion pad, and what happens is they'll lie in there for about 20 minutes and it will image both breasts. It gives us a 3D image of the breast, unlike mammography, which is two-dimensional, and it gives us images that the surgeon can use. It evaluates to see if a tumor is invading the muscle. It evaluates if there are any other areas besides the one tumor we have found. In our studies, 12% of the women who have MRI and breast cancer, we found additional lesions that we could not see on their mammogram or their ultrasound. There's absolutely no compression with MRI. The main discomfort that they have is they have to lie on their stomach and stay still, because if the patient moves, their breasts will move, and that will make a difference in reading their images. Our radiologists here, we are specific to breast imaging. This is all we do all day long, and we're certainly not perfect. However, we've had experience in doing MRI at this clinic since 2002, and myself and my other colleagues before we came here have read breast MRI and had fellowship training.